Hello, welcome everybody. We're just starting the webinar. We're just seeing some people join, so we're just going to give it a little moment for those numbers just to come up as you all join, and then we'll be starting our webinar shortly. Okay, so we're going to get started, I think now. Welcome everybody to the latest in our RSPH in conversation with webinars. My name is William Roberts. I'm Chief Executive here at the Royal Society for Public Health. It's lovely for all of you to join us today. Take a bit of time out at lunchtime, hopefully, to have what I think is going to be an amazing conversation. I love these. These are one of the best parts of my job. Today's conversation is really going to be focusing on how do we get a better future for our children, I guess. It's tough being a kid, I think, these days. There's lots of reasons why I think children really are the future, other than it was sung about 20, 30 odd years ago in a song. And to help me with some of that discussion is Dame Rachel de Souza, the Children's Commissioner for England. So welcome, Rachel. For those of you who are joining the webinar, if at any point you want to ask any questions, stick it in the Q&A and I'll be keeping an eye on that. You can do that at any point during the webinar. But Rachel, over to you. It's lovely to have you here today.
So thank you for the introduction, William, and thank you everybody for coming on to this conversation with us. What an amazing day to be doing it. Day after an election has just been called and we're all thinking about what's going to be in the manifestos coming up for children. So really couldn't be a more important time for having this conversation. So I'm Rachel de Souza. I'm the Children's Commissioner for England. It's my job to protect and promote the rights of children. This job came into being 20 years ago after the terrible death, you'll probably remember, of Victoria Climbié, who was killed by her extended by her family members, but every agency missed it. And so this role was put in as part of the Children's Act, into the Children's Act, to make sure that never happened again. And of course it has happened again. And it's memorable to all of us. I can say the names: Star Hobson, Arthur Lavinia Hughes. The job still, the job of us all being able to work together as agencies to protect children is never more important and still as important. So that really, as Children's Commissioner, is always at the forefront of my mind. I have a responsibility to look after all children, but particularly the most vulnerable and those living away from home. Now, how did I get here? So I was born in Scunthorpe, daughter of a steelworker many years ago, one of five. Actually, I was a teacher. Started teaching in 91, taught in a range of places, including East London, Tower Hamlets at the time, the second lowest performing school in the country when league tables came out. It was like an amazing place to learn to teach. Absolutely turned itself around, but it was a time when the Bangladeshi and Somali community were literally arriving, and talk about the need for multi-agency work with public health. When I look back, I had children in my classroom who had TB, and a range, of safeguarding issues that as a young teacher, I had no idea about. We did our best. So I became a head teacher in 2005. I was one of Tony Blair's first sponsored academy principals, took a school in Luton, bottom 200 school, and it had failed forever. And we got a fantastic team around me, and we were like Robin Hood and his merry men. We did whatever it took to get it right for those children, and we turned it around, got it to outstanding. It was the most improved school in the country that year. It's still, having failed for 20 years, we got it to outstanding. It's still good 20 years, all those years later, 18 years later. So that to me is what real school transformation is. I'd sort of got the bug. So I went off to Norfolk and did my second academy turnaround in Norwich, and then set up a trust. And this is where William and I have a secret connection. I set up a trust where I took all the schools that had been failing, that shouldn't have been failing because the kids were great, and brought them into a trust and did the turnarounds and set up some new free schools. So I had 14 schools, and William went to one of the schools that was in my trust. What did they call it before it became?
You had East Point Academy. You rebranded it and made it a lot more exciting than when it was Kirkley High School.
Tough call when we took it on. Ofsted had failed it on every single judgment.
Yeah.
But the kids were great. I knew they were great. But you were a boy there, weren't you?
I was, and I think it's interesting because I mean, you also talked about sort of your upbringing in Scunthorpe and coming from a relatively normal family, and I guess one of the things that strikes me when I've spoken to you before and when we've talked is, my parents also lived in Scunthorpe. That's where my brother was born. Dad worked there, and as the steel mills
We're in
closed,
the
we left.
stars. We are
Yeah,
siblings in the
totally.
stars, you and I.
But it's interesting because I guess your commitment to children is really unwavering. It comes through every time we talk, and I wonder. I went to Kirkley High School. It was a deeply normal school. Very little was expected of the kids at that school, and I wonder what it is that's attracted you to. I'm attracted to roles and inequalities. That's partly from where I came from and from going to what is quite a tough school,
Yeah.
I think. But what is it that's really attracted you to really helping those that need help the most? Because there's easier teaching jobs out there, right, than going to Kirkley.
Look, I've reflected on that a lot. So my mother was born in 1945 in Eastern Europe and was left as an orphan in a convent orphanage in Bavaria for 7 years and had TB, hepatitis, and came here unaccompanied. And my mother's family were kind of like a refugee family who were like obsessed with education, but I had all that in my head from them about Russia, the Ukraine, I had a Ukrainian stepfather, about the political upheaval. And then my dad's family were a kind of Irish Catholic steelworking family. And I think I learned very quickly not to trust politics, actually. I because of that, I was there growing up in Scunny in the miners' strike, the steelworkers' strike. I also had these East European refugee family who were like, education, Rachel, but they were also, kept me very informed about what was happening. So I kind of was never going to put my belief, I think, in politics, but I did put my belief in education as the thing, a bit like you would in health, actually. Education was my thing. Education is a thing I can believe in, that can turn lives around, it turned my life around. And I think that's where it comes from. And that absolute golden thread in my career is the belief that wherever you come from, whatever background you have, you can do as well as anyone in any strata of society. The best public schools, if you're taught well, if we believe in you, you can do it. And I do think it comes from that some slightly, I'm one of 5 siblings, no money, all that refugee background, and happy. I was absolutely happy. I had a great upbringing, loads of community, loads of fun. But I think I did, had to fight for it a bit, had to fight for my own education a bit, and it was my kind of transformation. And I guess that's why I find it so easy to have sort of that's why I'm drawn to those turnarounds and to showing that kids from underserved, disadvantaged areas can like do the best, be the best. We've just got to get behind them. And Children's Commission are the same. So, literally during lockdown, during COVID, during lockdown, it's the weirdest thing, wasn't it? Like, suddenly all my schools across Norfolk and Suffolk, North Suffolk, we know, Lowestoft, suddenly education that had been the one thing we could rely on just closed. And you'll have seen the same in health and in public health. And we were running food banks, delivering beds, doing all that sort of thing, as well as online learning. And the Children's Commissioner's job came up. And what I realized was the 20 years as a head I'd spent narrowing the gap between the disadvantaged and normal, and disadvantaged and everyone else. That gap, which had narrowed, had blown apart during COVID. It just blew apart. And for me, putting it back together was going to take more than we'd done before. And that's why I wanted to talk to you today. And that's why I'm happy to be here, because the way to put it, what we needed to do, I was looking at 1.8 million kids, out of school, on persistently absent, 100,000 severely absent, double pre-pandemic. I was looking at schools with food banks, cost of living crisis. All of this was happening. We were seeing it in front of our eyes, mental health crisis, the online world, all of it. And I realized that actually, unless we all work together and wrap around the children, and that's all the services. So whilst education had been really well funded before up to the pandemic, up to 2017, local authorities, public health, other services for children had not. and in the same way, and we had never got that nettle of true co-location and support around the child. And so for me, that's why the Children's Commissioner's job called me, and that's my mission, to narrow that gap by making sure that education, health, social care, all of us are aligned and working for every single one of those children.
And one of the things, I mean, it's, listening to you, I mean, one of the things that, you know, your passion fires through all of this. But one of the things, you know, we last year, you know, awarded you one of our honorary fellowships. And the thing that drew us to you was the sheer scale of ambition of actually really engaging and listening to children. And, you know, you undertook what I think is one of the landmark pieces of work around young people. Very few people listen to young people. It's older people make decisions for younger people. But your survey was really, you know, huge, varied, but also was genuinely led by children. And you know, what did you learn from talking to those young people?
So actually, we've just completed our second one. So the first, so when I came into post, I did the Big Ask survey and went out. We got 500,000 responses, and that was kids everywhere. Kids in youth prison, kids in yeah. I took my body around. It's a good job I didn't have COVID, because it would have been right around the country. I went everywhere, for every children's hospital, mental health ward, school, everywhere. And so we got 500,000 responses. We've just been, and we asked children then, what do you need to thrive following lockdown? What do you want for your future? We've continued with that conversation. I've just been out on the Big Ambition survey. They all begin with A and they're all big, right? 366,000 responses we got. So, and we asked, the question we asked this time was, what do you want from the next government? What do you want the next Prime Minister to do? So that's over 1 million children we've spoken to now. And, you know, why I love doing them and taking those voices to Parliament is because the children really surprise you. The young people really surprise you. So they coming out of lockdown, basically they were concerned about isolation, mental health. Before anyone was talking about it, they were there. Yeah, they knew 1 in 5 children were concerned about their or their colleagues' mental health. It was the number one thing. The second thing coming out of lockdown was getting back to school, getting back to education. Look at those absentee figures. You know, they knew, they were like, I need to catch up. I need to get back. I don't know how I'm going to do it. So they were their biggest concerns. But the ambition for the future was unbelievable. Like, the number one thing they all wanted was great job, great career. Kids were really teleological. You know, I was like, I hope they want to read Dickens or something. They are like, I want to know what the great jobs are. I want to be enabled to get them. I want to have a great future. They cared massively about their local areas. They cared about having things to do. They were worried about, they wanted sustainable, affordable things to do. So there was, and family came out really strongly. You could really see children with, children who felt their family life was, and that was in any shape or form, right? It wasn't some kind of like, it's got a rigid thing, but it was, if they had stability and love, they were fine. If they didn't, they were like 10 times more likely to be miserable. We saw mental health concerns, you know, for particularly older teenage girls, but going high. So that was 3 years ago. I've just got hot off the press the latest feedback from kids, and it feels very, very different, which I think is really interesting. So 1 in 5 of them felt that the people in charge don't listen to them. One of the things that came across really strongly was children are not cynical about politicians, in the sense that they think they're powerful. They saw politicians close their schools in 1 day. They saw the vaccine rollout. They also saw that they were completely invisible. So they are really cross about them. Only 1 in 5 think they're listened to. That is a massive figure, and that's nationally representative. And they want to be listened to. And that's why I'm calling for a leaders' debate for children. And I want to see every political party do their manifesto in child-friendly language. Should just be like a basic thing, shouldn't it? So I want to see that. This time, health came out really strong. So they were like worried about not being able to see a dentist. They were worried about, was the NHS, you know, is that going to still be there? They were keen about, you know, in learning more and wanting to be physically fit, their own well-being, recognizing their mental and physical health as really, really strong and key. Some really unusual things like maybe not unusual when you work with teenagers, but so many children, and this is the online world, right? So many children talked about when we asked the question, do you like how you look?
Mm.
Really kind of only 49% of children are happy with the way they look. And that's 60% of boys, 40% of girls, with a real ethnic breakdown as well. So, you know, with white children, white working class children least happy and girls least happy with the way they look. And I think there's something there really strongly pointing to how children's lives are now lived out in public online,
Mm.
and they're seeing images, and that again those themes came through. And you know, children with special educational needs and disabilities, 98,000 plus responded, you know, children with additional needs who defined it. 3 years ago, the SEND children with SEND who responded, if they felt their needs were being met in school, they were happier than the rest of the cohort. It's not the same now. Now they are less happy than the rest of the cohort, whatever. So we got some very, very strong. I mean, I could talk all day. It's all on the website, but you know, some really strong messages about what they want. But I would say number one, they want their voices listened to, and they want to be heard and be part of the debate.
And why do you think that is that we don't listen to children? I mean, we did some research earlier this year where we went and spoke to children about vaccines. Lots of concerns about vaccine hesitancy, lots of concerns about, vaccine availability. But I think it was the first time anybody had actually gone and asked children their views on vaccines, and
Well done.
they were remarkably clear that they trusted mum, they trusted dad, they trusted the school nurse, and they trusted the teachers. And those were the people that if they said to them, you should have a vaccine, they'd do it. And I just wonder why we don't listen to children more. What do you think it is about us as grown-ups that makes us go, well, somehow we know better than children? Because we wouldn't do that with any other group, would we?
And it's so difficult because actually, um, you know, you don't need to know that much about child development to realize that what most children how children develop well is they very much there's their peer group, but they also apprentice to adults. You know, they learn about adult life from the trusted adults in their life. And if we don't have those conversations and we don't listen, but also show by what we do, and that's why I'm not a great one for banning everything for children, right? If you actually talk to children, for example, about things like mobile phone and social media usage, they totally understand the issues and are actually crying out for our help, and don't need, you know, everyone under whatever is going to be banned from this. That's such a silly approach. I mean, if you start doing that, look, I'm 56 years old, and if you try to ban me from doing something, I go try and do it. You know, we actually need to be involving them in the conversations and the solutions. Let me give you an example, and this is a health-related example that came through. In fact, Chris Whitty called me the other day, a bit ago, and said, "Oh, really worried about sexually transmitted diseases on children." And I was like, "Oh, well, show me the data." Right. So, you know, clearly we can see we've got some of the worst data for gonorrhea and syphilis since 1918, 45 respectively, when that data started being collected. And I started thinking like, and children, like one 13-year-old have been diagnosed with gonorrhea every day. And under 19's been like the second fastest group, or under 21's been the second fastest. Sorry if my data's not perfect, you'll have it better than me. And so I sort of really, I said, Chris, we've got to go to Women and Equalities Committee. We need to talk about this. And I went with some health colleagues as well, from public health. And, you know, one of the things I started to look at was how are we talking about this and talking to children about this in school, right? RSE lessons. I taught RSE for years, right? And of course, what we're seeing is RSE, you know, relationship, sex education, been taught very patchily, been taught by non-specialists, been deprioritized in the education curriculum. When I talk to kids, so in my surveys, what should the government do? What's the most important thing for you at school? The number one subject they thought was the most important was RSE. We want to learn about adult life. We want to keep ourselves safe. We're clearly, you know, developing, you know, in sexually and as human beings. We want to understand it. We want to talk to our teachers about relationships. And yet we've completely deprioritized it. And in fact, I would say, as a nation, are almost terrified about talking to our children about it. And the latest guidance on RSE, you know, if you look at it like, you know, oh, it's got to be covered in science and we mustn't talk about this. Truthfully, you know, if a child has a young person has a question, you don't wait till they're 10 or 13 or 15 to teach. You know, you deal with it then and there. Given that my research shows, you know, 25% of 9-year-olds have seen hardcore porn, I think we need to be talking to them about it, right?
Yeah,
So
absolutely. They're not going to suddenly lose interest in something that
yeah,
you've told them to lose interest
yeah.
in.
So I think it's as I think we just give the adults half a chance in education and they slip into what is the knowledge that children should be, you know, we should transmit to them. How do we manage them in terms of, like, you know, how we seat them, how we do their school dinners, how we, you know, give them sport, rather than these are apprentice adults, these are human beings, and we need to have proper conversations just like we'd want with ours. And we need to be brave and bold and have an ethos and a vision for childhood. So I mean, I am with you, William, on this one.
Yeah, I think we are. I mean, I've got a couple of questions I'm going to come to in a minute that have been asked by some of our audience members. I guess just reflecting on that. I mean, certainly we've been talking about workforce, and you know, a shout out to any of our school nurses on here. The challenge
Love
of school
school nurse.
nurses. We love school nurses,
Love
but they
you.
can't do it alone, right? So we
Yeah.
genuinely think there's a how do you create a team of people with the skills and knowledge to promote health within schools? And that can be supporting teaching assistants, it can be supporting parents, it can be supporting, you know, the teachers themselves. And you know, and I'm reminded of like one of public health's greatest hits, which is teenage pregnancy. And teenage pregnancy was doing a range of things, supporting children, but at the heart of it was empowering women to make choices,
Yeah.
not asking people to stop having sex. And I think there's something really interesting in there to think about how we, you know, young people want to be heard, but they also need to be treated with the respect they deserve. I've got two questions. One from Woody, who's and I guess these touch base something you said earlier about sort of like the most vulnerable children. Um, you know, the skilled workforce to teach children. What's the role of head teachers in supporting? He'd asked previously about supporting, you know, looked after children in school, but also this idea of supporting, you know, the children with the greatest need. And we've also got a question just in the chat there from Elaine about the increase in neurodiversity as well, and how can we use teachers and schools as a way to engage in helping people with those issues rather than waiting if necessarily for, you know, the NHS to be able to take the support for them. What are your views on sort of democratizing health into schools?
We absolutely have to do this. And frankly, it's, you know, where do where do children go every day for all those hours, you know, and where who do they, and your point about who do they trust, who do they get to work with? So look, I'd have a school nurse in every school, right? But you know, we've our school nurses are a bit too thin on the ground, but a school nurse cannot do it all. And in fact, spend so much of their time having to chase on safeguarding issues, that we have to make sure we've got an education workforce that does not just what's happened in education. Sorry, I'm cutting myself off with my thoughts, but what's
No, go
happened in
for it.
education is we've got polarization of, and it's a completely false polarization of those who see themselves as and talk about themselves as progressive, child-centered, trying to wrap around every individual child, personalize, and would be very comfortable talking about seeing themselves as you know, supporting children's mental health, making sure that skills and all of those things are sorted. And then we've got those who have would sort of define themselves more as traditionalists. So you've got your kind of progressives, traditionalists, and on this side, it's much more, you know, we are here to teach this subject and to, you know, teach the curriculum, and they're often fantastic teachers. And we need to, you know, SLT senior team could deal with behaviour. Other people need to deal with mental health issues or other things like that. And actually, there's something about these two positions being brought together, and a recognition that actually the best mental health support is delivered in a great ethos in school. I mean, I talked to Sarah Jane Blakemore when I first came into post, who's Oxford, neuroscientist, and said, "What can we do about the mental health crisis? What's the evidence?" And she said, best thing we can do, the only really true bit of evidence is, that what she would give me is if children have good peer relationships, small number of peers, and spend time together and enjoy their time together, that's the most protective thing for their own mental health. We should be having activities on at school, enough sport, enough fun, not narrowing lunch times, extending lunch times, thinking about, how we're developing our children as human beings, giving them space to talk, fun things to do. That is going to, and not using language. I remember as a head listening in at exam time doing this, I can see those year 9 girls, those 14-year-old girls, where the teachers would say to them, this exam matters so much for your whole life. And suddenly the anxiety clicks, and the whole language we're sort of giving children in school is anxiety language. When I was 8, 9, 10, 11, actually right up to 15, I didn't know what I wanted to be. I didn't think about exams. I was free. I see 8-year-olds now, and 8-year-olds responded to my survey worried about what job they would do, worrying about what the future holds for them. And you can see that kind of almost we're driving this anxiety through the kind of assessment processes, instead of you could do the same, have the same, SATs and this and that, but actually it doesn't matter. It's okay. Try, enjoy. This is about, and I think attitude, ethos is everything. And I think our heads and our teachers, we need to be training them before they become head teachers, training them when they are teachers. We need to be training senior leaders in health education and social care together, so they understand each other and realize there is no magic bullet outside that door that you can send a child for a neurodiversity assessment and then everything's going to be fine. It just doesn't work like that. You can get your assessment. It's not all, you're still the same person. So I think there is a huge conversation that needs to happen. And we need to be working together, and schools have got to do it. They've got to do this.
And it's interesting. I mean, I've got several children, a number of whom at the moment right in the middle of exams, and I see that. I mean, it's tough being a young person these days. I mean, shout out to my children who are brilliant and they're doing really well and working really hard. But the pressure they're under, and I see it with my own children. I see it in the data we see. What's your sense of why we're putting children under so much pressure so young? Because they talk about this with the mental health issues. They talk about the pressure they're under, whether it's body image, whether it's exams, whether it's career. Why is that? What do you think is driving us as a nation to make our children lose their childhood to some extent?
So I think 2 things. I think one is very much within our power. One is probably a world issue. So, there has been, since I became a head in 2005, there has been a drive to raise standards, and certainly since 2010 to map ourselves in outcomes against internationally, so the OECD, and to do well there. So many of our ministers went off to Singapore, to China. I went to China with Liz Truss when she was a junior minister, and we went round and looked at maths classes everywhere. Can you believe it? And so there has been this standards drive, but alongside that standards drive, there's also been an accountability drive. So heads and teachers are very much feel judged and rewarded or punished by their outcomes. So those 2 things have, I think, created a level of anxiety in head teachers. If you are not a confident head who can say, I am not putting round pegs into square holes. I am going to do the curriculum. I am going to do what is right for this child, these children. I'm not going to care about league tables. And actually, you can do that. Yeah, you can be a very, very good head. And we didn't do that well in that this year, but that was for a good reason, or we're not following that. That's the whole point of all these freedoms over the past year. We're meant to be able to develop a curriculum that suits our children. But I think the pressures and national kind of league table kind of things have, combined with a profession that wants, I mean, what is the kind of mindset of a head teacher? They want to do well. They're quite anxious. They're quite, and so this all conflates into what should be your 11-year-old SATs should mean nothing to an 11-year-old. It should just be something they do that day. And instead, we've got coaching, hot housing, worry, anxiety, for no reason whatsoever. It doesn't affect that child at all. It's a national measure of how children are doing. So I think there's something about what the government's done, how the professions responded to it, alongside the accountability that's caused us an issue. Add then Ofsted, he's coming in and judging you on your data, and you end up with this. And I am actually very pro having a good inspectorate. I'm pro standards, but I just think we've almost, I don't know what the right word is, we've sort of pathologized this whole thing and created a mess instead of really prioritizing confident, supported head teachers who will do what they need to do for their children and are ambitious for them, but will create, we'll if that's not right, we're not doing it. Boom. Yeah. So there's that bit.
Absolutely. And, throughout my career, whoever you talk to, you always, every person you talk to about their career, you find one head to, is a teacher somewhere has inspired them to do something. Yeah. How do we get back to that? I think. I mean, you've touched a bit on sort of, the challenges of modern life, the cost of living, the real seismic changes I think we've seen in the last 5-6 years culturally as a nation. And I just wonder, Gordon had asked a question about how do we, what he describes as poverty-proof childcare, how do we make it so that kids who are, suffering with poverty, and we know more children are now in poverty than at any point in the last decade, how do we make sure that doesn't stick out so that kids can actually get the support they need, the help they need, without actually sort of almost putting them in the poor queue? How do we do that?
Yeah. So the first thing I'd say is, when you go to places where children are, I mean, I talk to, groups of children right across country, everywhere. So when I did the Big Ambition survey, I was out for months talking to children, every single corner of this nation, everywhere. I did not, every single child I spoke to, I think that with the exception of maybe one, talked about being concerned, their parents being concerned about the cost of food. That's how changed the situation is in 3 years. It was not like that 3 years ago. There absolutely was poverty. There absolutely was problem. But I think it's become almost such a wide-reaching problem. Children are openly talking about it. Yeah. So in a class of 30 students, an estimated 9, so that's a third, will be living in poverty. And it was a really big theme in the Big Ambition, my latest survey. So we've got a problem, and we absolutely cannot ignore it. So we did a poverty paper. So basically, when I did a Big Ambition survey, I then hired 16 young ambassadors who then helped me talk to, and you were there, William, for the health one. We had conversations with leaders in every single service area. It would have been better to bring them all together, but we had 15 conversations, everyone from prison governors, health leaders, you name it, education leaders. And out of that, one of our papers was the sort of poverty paper, where we put a number of ambitions in there to try to, things that come from children, that from those discussions we felt we could do. I mean, there are some really sort of, I tried to go for the practical, because we all want like the great big, like, of course child poverty has got to be our #1 target for any new parliament, and but what could that look like? I mean, so we were right down to like auto enrollment for free school meals, so that you're not having to, and where necessary, I would extend free school meals definitely to those on universal credit, because that is a group that group where parents are working but been paid very little is I worry about them almost more because they're often not able to access any of these things. So there's the food side, there's school breakfasts. I mean, it should just be and you be able to either pay, if some parents want to pay, fine, not pay if there's a problem, and it shouldn't be an issue. It's cheap, it's easy, there's funding. So we need to sort that bit out. But for kids are worrying about things like the cost of student loans, because if you are from a more disadvantaged background, then that weight of that £50,000, £60,000 student loan, especially if you're going to be going into a job, and it doesn't matter how many times Martin Lewis tells you it's it's a graduate tax, it's okay. That's a real worry for kids. So we need to think about the kind of, and I would also triple lock the child allowance, a triple lock child benefit. We triple lock pensions. I mean, there are some very sort of practical things we could do, with welfare. I think the whole welfare system needs to be rebooted around children with families with children. If you are, look, I'm not either oring. If you need welfare, if you need that support, you need that support, but you really are not in a good place if you are a parent with children. And if you've got more than two children, you really are not in a good place. So I think we need to rethink the benefit system broadly there. And there just needs to be a mind shift of we've got even now the sort of young graduates who would have been our most affluent are not having children because everybody is terrified about cost of it, cost of childcare. So we need to go through the whole thing and actually make it, because we're not going to have a nation left if this carries on. So
Yeah, I can see that the challenges there. You talked about the two-child limit on
yeah.
benefit. I mean that feels like a regressive tax, if I'm honest. It's £3 billion to change that. We know that the data says nearly all of that money goes straight back into the local economy. People spend more on fresh fruit, healthy food, less on tobacco and alcohol once they have that money. Why do you think, that seems like an obvious thing for any incoming government. It's a small amount of money in the scheme of a huge amount of money, but not in public sector finances. It generates huge benefit. And we know from the recent IFS study on the economic benefits of Sure Start that you invest in children, that money pays back for generations. So why do you think it's hard for politicians to make that decision? Because you'd think it wouldn't be hard to say, let's look after kids and give them the chance to be the best they can be, would you?
So, I mean, I think there's a number of things. I think there's politicians playing to their poor electorate and the popularity, and how things are put across. But I mean, it seems incredibly short-sighted. But I think it's more likely that we've got Treasury bods who are trying to see things in 5-year blocks rather than lifetime benefits. And that's what we need from whoever forms the next parliament, is to look at the lifetime costs of some of these decisions and how what might look like a deterrent or a short-term saving now will actually translate into, I mean, and actually, I'm not even going to make that argument. The argument I want to make is, have some moral sense. Just do what's right. No politician truly goes in there and does something because of a treasury argument, really, do they? They should be doing it because, they've been elected and this is right. And we should be asking for moral vision and moral purpose, and care for our children. Boom, there you go. That's what I really think.
Good, and I think we'd agree with you. I think we know what an impact the last child poverty strategy made back in the early 2000s. We know how that tackled child poverty and had a real impact. And similarly, we know what the £20 on benefits did to poverty during COVID. You can see the data; it shows it. And I just wonder why we sort of stand at a set of choices, don't we, ahead of this election? And I guess there's both a moral case, there's a financial case, but I also think there's just something, as you say, about doing the right thing and doing what most people probably think you should be doing. I suspect most people don't really understand the complexities of our tax and benefit systems. I know even for those who are experts in it, it can be a slightly
Yeah.
Byzantine system. I'm going to go back to something you said earlier because there's been a question about this in the chat, and I guess you were talking about sort of the huge number of children who are persistently absent from school. The question in chat specifically says, what do we think we could do more if school nurses, who I know are a deeply precious commodity, and health, health trained people, public health professionals were more engaged with schools. What are the things you think we could do to support schools to get those children back in? And what do you think the role of school is in supporting people to tackle that sort of persistent absenteeism?
So great question. Where our research has shown a number of things, that the main reason for that serious absenteeism, so not just when you break all the absenteeism down, some of it is just got into the habit of not coming in on a Monday or a Friday, or where school can easily turn that round, frankly. Actually, I've seen schools who had the most challenging persistent absence data turn it around by just putting great things on a Friday and putting some supper on and fun things and and they've turned literally Hewitt School in. Go look at their. You could go look at their data. Hewitt School in the middle of Norwich that has some of the most challenging intake. Have just turned it around by making Friday after school great. Really, really good. And so kids run in on a Friday. So there is a huge role of school to, if kids like school and school, is doing it for them, they'll be there with a little bit of help, sometimes a little bit of push. So there's that bit, but there are also the problems that, when we look at the more severe absence issues, tends to fall into buckets. It tends to be children with special educational needs who feel their needs aren't being met, who just in lockdown just went home and never came back. There's the mental health anxiety bucket that is everything from some things that could be done at school that could be very, easily done with a bit of thought, right through to sort of serious tearful cams, needing dealing with it. And then there are those children who just have not come back, who are often from very disadvantaged areas, who disadvantaged homes, who are often suffering trauma, at risk of criminal exploitation. Now, what can we do? I have been plugging away at this, writing national policy reports, sitting on the National Attendance Alliance and not seeing any change and feeling really frustrated. So I've just convened with Andy Burnham and with the Manchester mayors with us. I've just convened the Manchester Local Attendance Alliance. So I started with 11 chief execs because I thought if I can get the LA chief execs on side, that's the start. We then brought in the DCSs, the ADs, and we've just brought in health. And what we're saying is, let's move the dial for September. Let's really dig down. And so the DfE has done some fantastic work, really granular work on the data as to why, and what difference certain actions would take in Manchester. So if you basically got rid of Friday absence in Manchester, there'd be an extra 1.5 million days in school. If we've looked into where it's health, where it's whatever, we've really, really done it to each area. And many of the areas had done it themselves. And what we're trying to do, so we've decided in Manchester, we're going to look at year 6 to 7 transition, because that's where, so children going to secondary school is often where they fall off. And we're really focusing in on preparing the kids for getting into year 7, making sure any of those barriers, whether it's teacher doesn't understand me because of my neurodivergence, whether it's I've got special needs, whether it's I haven't got shoes, whether it's no one's there to take me to school, or mum's taking the kids to 3 schools and can't drop me, whatever it is, we're going in for it, which we're working with all the head teachers as well. Health have been really helpful. So they are focusing on, what I've asked them to do is focus on any year 6 child into year 7, any mental health support, anything that they need from health, let's try and get it done. And we're seeing what actual practical actions can we take that will have impact to turn the dial in September. And if nothing else, bringing all those people together to work together, like the dentists are coming now. We're bringing the VRU, the police, everyone are coming in, youth justice, and we're trying to make it a real thing. And then if we can do that well, we can then, because look, next parliament, whoever it is going to be all about local. And local is going to be the solution. So we're trying to model how to do that kind of area-based work where we all work together that can really impact on an issue like attendance. Again, the school nurses are there, everyone's there. So I think there are many, many very practical things that can be done. And a lot of it is, and I say this as someone who was a head teacher for all those years and has been guilty of getting it wrong a million times. So much of it is, don't exclude that child for wearing the wrong trainers. There is a reason, and let's try and find a more positive way to deal with that and understand that child is that, come on, all these sorts of things, and make school a good place to go. Don't want them in isolation for 3 days. It's as heads so often, especially into secondary, it becomes hotel management and crowd control more than we need to deeply understand each individual. And the more we make our heads confident in doing that, and that nothing will go wrong, things will only go better if you actually really engage on these things, right?
Yeah, I think like everybody does stuff if it's fun, right? Everyone does stuff if you get something out of it. We spend huge amounts of time in businesses talking about value propositions and customer journeys. And I guess we just forget that when we think about young people. We just assume they're just going to turn up because somebody like me told them to. And I think you're right, that engaging them is such an important part of that. One of the things you talked about in there, which is really interesting, is about this idea of coming together and working together. Lots of public health people are currently talking about the idea of health in all policies, or if you like, every policy does what it can to improve health as well as the other thing it has to do. If you had your magic wand, and the Prime Minister came to you on July 6th or whenever it is, July 5th, 6th, and said to you, Dame Rachel, what I really want from you is to sort out how we work together around children. What would you do in terms of thinking about cross-governmental working on this? How would you make that work? Because that's one of the big challenges, I'm guessing, to some of this.
Yeah, you see, it's interesting, isn't it? Because the two big things bandied around often are have a target for the whole of government about children, which is a good idea, but it's not going to make what we need to happen. It might help, but it's the start, not the end, right? And let's have a children's minister. Now, first of all, that somehow you could put a minister for children there, and that Home Office, health, everybody would accede to that. Is we're going to have to do more than that. I mean, you could Bridget Phillipson, if she comes in as education secretary, will say she's a children's minister. So I think it needs a whole lot more work than just saying those two things. And I know that's a holy grail and that everyone's been saying, oh, we need this, but actually it's what happens under those silos that is, when I look at the two groups I think need to work together most and are the furthest apart, it's health and education. We need, and social care is there in the middle, sort of like, because social care and education don't work together well. Children's social care and education don't work together well. And then social care and health, you often get, they should do this, they should do that. And we've got these silos, we've got these massively different ways of working, and that's what we've got to overcome. And, I think whilst I would value really good cross-government ambition, working groups, bringing people together on, bringing ministers together and incentivizing them to work on the same things. I mean, I don't think the Home Office should be allowed anywhere near children, so I take children off them. I don't think Justice should be allowed to deliver education, but other than those two beefs, I think it would be about, we've got to get these ministers together with junior ministers working across the two. There's things we can do at Westminster, right, that would work. But what I think would be truly inspirational, and that what we need to see, is really modeling us working together on the ground and really doing it at a local level. Because unfortunately, having been down in the field for like 32 years and then up in Westminster for 3, what I can see is that Westminster changes very little. It really is localism, and it's local that's going to make the difference, like that attendance alliance image. But I would go even smaller. You know, we need to be some of the most, I've just come back from Australia, and some of the most exciting things I saw was health saying, right, we are going to co-locate on this school. I was particularly looking at Indigenous outcomes. We're going to go co-locate in this really disadvantaged community where there's high level of Indigenous. We're going to put on the family groups. We're going to have local workers. We're going to do the after school clubs. This is health. We're going to deal with it's not we're going to go do clinics. They were leading on all of those kind of people things, and we're going to persuade the head teacher to work with us. They don't quite know what we're doing, and I think actually we need those models of how to wrap around schools, how to physically be in the same place, and how to learn to work together for the individual children. It's, for me, co-location, the physical space is important. I don't get hung up on whether we call things family hubs or sure starts or whatever. I think we need a much bigger vision than anything that's gone before, that is, because the problems are bigger, that is about really physically bringing the services together and wrapping around the children and working together, and making sure all of our training, development, outcome measures, you know, for children are the same. I want health to be judged on attendance as much as education is. And I think education should be judged on mental health as much as health is. You know, the days of saying, CAMS aren't doing this, you know, CAMS, you know, from head teachers and it's got to start. We've got to do it together. So yeah, for me, it's roots. It's down at the roots.
Yeah, I mean, the great stuff that, you know, you talked about family hubs and Sure Start particularly, both of those were in the community and for the community, weren't they? And often
Yeah.
staffed by the community, and they were very much thing. But I guess the other lesson from that was that change happened at the speed of trust. So people built relationships, they trusted each other,
Then
and that's how they delivered. You know, it wasn't about a doctrine, it was about, here's the framework, get on with it. And it was local people who were all after the same outcome, I guess. There's a question, you know, we've talked about this sort of thing of giving you a thriving childhood and the freedom to be a child, and also just the challenge of the modern world. You know, it's an incredibly competitive world we live in. Rachel's asked a question about how do we support those in working with children, to sort of protect the freeness of children, but also, you know, giving our children the best chance to compete in the modern world and succeed. How do we balance off, you know, a bit of grit and pressure with a bit of joy in childhood? What's your sort of sense of the balance of those things?
So I think I made quite a strong case that there has quite a lot of imbalance that's come into those things, and combined with that, more anxious parenting. I mean, if you're reading all I mean, watching all this stuff about banning social media, Jonathan Haidt's work. Actually, what is strong in Jonathan Haidt's work is the recognition that in the 90s we became so safety conscious that our children lost freedom at home as well. You know, the kind of freedom that you and I probably had, William, to play out and go out and do all those things. Those and roam free. Yeah, we've also, that's changed. And then the whole online, you know, kids are coping with the whole online world, and the sort of uh, you know, for me, since 2010, working with young people, more and more, they have become more focused on themselves as individuals. And that's social media, and that is the online world. And so the answer to dealing with all those pressures has to lie in really brilliant leadership from our professionals. And you know what? And whether that's the health professionals you're engaging with, whether that's the head teachers and the teachers in the school, who, you know, I think have got a huge job to do here, or the other services. Now I have absolutely no nothing holding me back in making that ask. We are certainly the head teacher workforce is highly educated, really well paid, and should be doing this. And this is what our mission is, to make sure that our children aren't too anxious, but can get their out, but we can be ambitious for them. And that what greater honor or pleasure or joy is there than being able to work with the next generation and do exactly what you said. And we so often either talk about the most vulnerable, where you are often talking about serious problems. We either talk about the most vulnerable, in that way, or we talk about everything. We talk about the entire cohort with a sort of negativity. It's too hard. There's not enough money. The world is whatever. Whereas actually, I think we need to turn it. And yes, we need the funding and but actually, it should be joyous, and it should just be what we do. And we need to change the narrative.
Yeah,
Let's hope Change of Parliament gives us an opportunity to do that. Yeah.
Yeah, and I think that the message that let's let children grow and have joy and enjoy themselves, and let's make school something that they want to do, because we know that I could go back. I look at the books in my office that are 200 years old, and we know that the most powerful way to often get people out of poverty is to give them an education and give them the opportunity to develop. So I think there's lots in there. We're nearly at time. We've had lots and lots of stuff. If you were to leave our viewers today with something to take away, what would be your key message to the range of public health professionals we've got on this call? What would you say to them? What would be your message?
I will say to you what I've said to every shadow cabinet minister and shadow junior minister and government minister that I've met in the past 6 months. And I meet them all, right, and talk to them about what the children are saying. I'll tell you what was said to all of them, which is, now is the time to have a vision for this, a great big vision for children, not incrementalism, not small. This is a moment where we've got to go big, and have a vision for childhood, a vision for how our services we're going to work together for children. And I think, we can do it.
Brilliant. So go big or go home, I think is what we're hearing there for people. Absolutely love that. If you love what you've heard today with Dame Rachel, you can go and have a look on the Children's Commission's website. They have got some amazing stuff. The Big Ask is great. The Big Ambition is great. There's so much in there. The 15 different reports you also recently launched, with I think have a welter of practical things you can do. At RSPH, we know that health is more than healthcare. And so there's suggestions that run across all sorts of different walks of life, around social media, around education, around business, around jobs, around roles. There's so much in there. So definitely go and have a look at that. If you're interested in more from us on the issue of inequalities and health, we've got another webinar coming up in a few weeks with Jim McManus as the Director of Population Health for Wales, worth coming along to. But just to finish up, we talked at the start about our vision for a better, brighter future. I think that's been pretty inspirational. I know some people have just put in the chat they're about to go, but thank you so much for sharing your vision. It's been a joy to be with you today. And Rachel, I'll give you the last word before I go.
Oh, just thanks everybody, and let's keep going. Let's do it for the kids.
Brilliant. Well, look, it's been a pleasure to see you today. Thank you so much for your time. Thank you, everybody, for giving up an hour in the middle of your day. I hope it's been energizing and exciting. And for all of our members, this will be available in your members area on the RSPH login website. Just remains for me to say thank you to the team for putting this on. Thank you to the Office of the Children's Commission for England, and thank you to you, Dame Rachel, for what I think has been an amazing and energizing lunchtime. Thank you so much, everybody. We'll see you all soon. Bye.